And I've been very disheartened over the years as to what we can and can't do when other people decide how many visits we get with a patient, what we can and can't do, what is and isn't covered. So I needed to find another way that I could run my own cash-based business. So I hope to be able to do that at one point, but that means I need to be able to finance my student loans with Mary Kay, just straight up is what kind of needs to happen. But anyway, I do love physical therapy, and what's really neat about physical therapists is there's 4 areas of the body that we're trained in. So one area being obviously musculoskeletal, which you guys already know about, neuromuscular, so more how the nervous system works within the muscular system outside of just orthopedics. Also, gosh, oh, the cardiopulmonary system. So you see a lot of us in ICUs and those kind of settings. Cardiac rehab is one big thing we used to do anyway before we start getting paid for that, regardless. And then the last big system we actually treat is the skin. And it's very little known actually on what PTs do with that. It started really back in the 70s, back when we actually first started, we came out of World War II, physical therapists did. But when it comes to the skin, the idea that the skin and healing with it. We are the only other clinicians besides physicians and besides wound care nurse practitioners that can actually do sharp debridement. So we're trained in a whole lot of advanced modalities for the skin that, well, you don't see us do a lot unless we're in remote places, simply because, that's where the need is as primary care providers that we're trained to be. So it's kind of neat what physical therapists are and do, but that's kind of how the segue into Mary Kay. So I decided to be a Mary Kay consultant when I was 18 because I'm like, I want to be able to know what's in my skincare. It's got to be safe. It's got to be effective. And honestly, guys, I got to get it for half price. Who are we kidding? I do not want to pay full price for anything. And at 18, how bright are we at 18? You know what I mean? But anyway, I decided to start my business in earnest after being quite accomplished as a physical therapist, but realizing that's definitely more to life and wanting to be able to put family, God first, family second, career third was not something that a business of any kind really seemed to allow for me in the settings I've been working at. So anyway, here I am today talking a little bit about what I think is most helpful for you guys at this point, really desk ergonomics. And who knew it was going to be even more important right now with COVID, because now you all are working from home. And just over the past 3 months, my caseload has really, skyrocketed with telehealth simply because people are in a ton of pain from working at home. They're no longer in their work settings where they've had ergonomic assessments. They're working. I have one girl working off a Costco table. As you can imagine, like that's really not great for her shoulder or her neck. I have another gentleman that was working on a bar stool, and I'm like, really, dude, come on, get a chair. But small things that we never knew were going to be quite so important. When I first switched over from working in SNFs to our skilled nursing facilities to outpatient, one of my very first patients was a lovely woman. She worked from home entirely, because she had kids. It was really neat. But the way her desk was set up is, how your arms are supposed to be, right here when you're sitting. Her mouse was here. She worked with her mouse up here for 2 years and had a full and complete rotator cuff tear. So, the moral of the story is don't do what's convenient because you never know what is going to change to your body. So anyway, I'm going to go over to my slide presentation. So let me see if I can share my screen here. Let's see, here we go, and share. Okay, and let's see from the beginning. Maybe? Oh, there we go. Okay, so a little bit about posture and desk ergonomics. What was most useful for you to know? So a little bit of a presentation of the overview on physical attractiveness and posture, just how posture really does play into not only how do we network, how do we greet people, but also our physical health and well-being. What is good posture? Is sitting really the new smoking? I'll go on to that. The power of reverse posturing, and then finally preventative desk exercises. So I want to talk a little bit about like the carryover between posture and, if you will, maybe the idea of cosmetics. But what that comes into is when people first look at you, what do they really see? What is considered attractive? And yes, we all know maybe fitness and weight is one of the top ones, but it's followed very closely by things we can change and are things that we can change easily. Hairstyle, makeup, and posture. Now, some postures are easier to change than others, but we can go into that later. But those 4 are more important than like what you're wearing, what it looks like, how it fits, your shoes. Well, I don't know what shoes, guys. I don't know, as women, shoes are shoes. But then also even, the color of our teeth, that kind of thing. Those are far more important. Then, kind of goes on to about those self-care features, also important to attractiveness, but also more importantly for us, approachability, being able to really network with people and share our work and our business. And then, as I'm sure some of our other speakers have talked about, posture is important because it is a direct projection of your sense of self-worth. And the carryover from Mary Kay is more the idea of women empowerment, that you can do whatever you want to do. You don't have to have all these degrees behind your name to be, remind me later, sorry, to be successful, to be, whatever it is that you really want to do with your life. And then Obviously, posture seems to accurately portray personality characteristics. So people are gaining information about you just by seeing how you hold yourself, how you present yourself to people. So again, something that's important for our businesses. So let's talk a little bit about spinal postures. Now, as you guys know, I am a clinician first, so I tend to go on and on about things I think are really important. But the real issue is that when we learn about what we should be sitting at, what the desk ergonomics should be, why? Why is it important? So I want to key you in a little bit about what we look at as far as the physics perspective of what is going on with the way gravity is really coming along, or affecting our bodies. And then the idea of what muscles are important for you to activate as well. Because if I just tell you what to do, you don't really have an idea of why to do it. And I find that with my patients that they won't really do their home exercises unless they know the why. Why is it important for them? Why should you be invested in these kind of things? So anyway, so spinal posture. So we know the ideal is this red guy in the middle. And if you look at that dotted line, we call that a plumb line. So a plumb line is literally like the line of gravity falling directly through your body. So the big part to note here is that it starts here, it goes right through your ear, right through almost the front of your cervical spine, or right in, you know, where the spinous processes are here. Goes in the front a little bit through here. Let's kind of write the idea where the heart is. Right through the middle of your lumbar spine, right through the middle of the pelvis, through the greater trochanter, through the center of the knee, and all the way through the ankle. Now you can see the other postures, all of those differ a little bit. So let's look at the one that's probably the most, that's probably not the most common. This one is what I see a lot, the sway back, especially with prolonged postures. You look at your teenagers. This is a lot of kind of what they look like. But you see that with all of these other postures, we've got that forward head. The line of gravity is not following through the ear. And with all these other postures, that means the wrong muscles are being turned on and activated to stabilize the neck because the line of gravity is falling in the wrong place. So if you look at here again, so instead of the muscles in here stabilizing you, or being able to stabilize you, they're inhibited based on where the line of gravity is. And instead you've got your neck movers back here. So you guys, do we all have that point right here between our neck and our shoulder, that's a big old muscle knot? I think a lot of us can really kind of, feel that. It's like, oh my gosh, mine's worse on the left, who knows why. But what that really means is that's your upper trap and your levator scap, those two muscles. Those two muscles are neck movers. They are supposed to literally move your neck several different ways, but they're not supposed to stabilize your neck. When we have any position of this forward head, those muscles are now trying to stabilize you. So if you've ever had, long day at work, I mean, I know I have a lot of my patients right now are working 12-hour days on Zoom, especially, but the more we have that, and it just has to be slight. So even here, I'm in a forward head posture. This is a little bit slightly normal, but any of that, you're going to get more and more of those trigger points, those knots. And no matter how many times you go to the massage parlor, no matter how many times you try to have, beg your husband to work them out for you, they're not going to go away unless we change the way gravity is affecting our body. So, I mean, it should give you hope, though. There are ways to really turn these muscles back on, but it's not as easy as doing one or two exercises. A lot of it is just the idea of incorporating mindfulness in how you sit. Anyway, regardless, I could go on for this all day. Let's go on to the next slide. So you guys are here because you want to learn about maybe ideal posture, especially sitting or standing at a desk. Standing desks are all the rage. There's a lot of great things about them. They have literally saved my patients with herniated discs, whether in the neck or the back. But they're still a static posture. So that's, looking at here, you guys have probably seen some of these illustrations where your eyes should be, right here, where it's really, was it 2 inches below the screen? So that way your head can be in a neutral alignment, where your shoulders should be. And I like the shoulders back even a little bit farther, simply because you don't want to activate these muscles back here when you're sitting using anything. You see how the feet are supported here. So the hips and knees are really at 90 degrees. So there's equal weight bearing right through the spine, through here to here. Same thing in standing. Now this picture itself, do you see kind of how he has a little bit of that sway back through there? Yeah, this guy's doing something wrong, but I'll go over that in a minute. So this is ideal posture. So let's go a little bit more into that. So again, we talked about the neutral alignment from skull to tail. Core muscles will experience the least amount of fatigue and will likely be able to support the position longer when they're in this neutral position. Now, I don't know about you guys, but I'm a fidgeter. I cannot stay in one place, nor do I have a really good chair like Sherry does. But the idea is that this is the least amount of activity our muscles will have to do. The problem is when we start shifting our weight, when we start moving that head out of alignment, when we're reaching with our arms, all of that changes. And instead of our stabilizers being active, our movers are being active. And unless we switch back to that, our stabilizers will get weak and inhibited, and our movers will try to take over. A little bit more about, the little scientific facts about, how weight is evenly distributed. Shoulders are relaxed and supported to avoid recruiting the prime neck movers, which we talked about a little bit. I hope I'm not talking too fast, guys. If you need me to slow down a little bit, I get really excited about this stuff, so just let me know. But then again, we talked about the eyes being centered. So let's go on to the standing desk. So we're talking about that plumb line going right through the center. Oops, sorry. Oop, can I go back? Let's see. Back here. Okay. From current slide. Anyway, the plumb line going right through here. And so you can see in the plumb line here, we think we go through his head, which is good. And we need to do a little bit, the humerus is back a little bit too far. And again, going down through here to the feet. So a couple things wrong with him in general, but a lot of it is the sway back. So in this position, instead of being like this, you can see how there's a little bit of sway back. The idea is to tuck your tail. It's a very slight motion, but the idea is flattening your back just that little bit, and that's gonna put the line of gravity back through my body. Very slight movement. Now, something that's hard to sustain and hold for a very long time while standing, that's why the idea of talking about what is ideal static versus what really happens at a standing desk are two very different things. Okay, so what I want to go to now is just one of those handouts that I see. I don't know if you can see these guys. Can you see the proper use of seated workstation? No? Okay. Let's go back here. Let's go back. I'll just talk about it. So one of the handouts talks about the really properly for sitting and for standing, and it goes over this a little bit. It does include that the idea when you're standing for prolonged periods, having something that's more of a pressure relieving surface for the feet, or wearing, you know, cushioned shoes. But that'll be a handout that we'll be able to share with you later. So we talked about a lot about static posture. And the idea is it's really, you know, static sitting, static standing, is that something that, is that really the ideal? The real problem with sitting, and why sitting has gotten a really bad rap probably over the last year, was that it's the opportunity cost. If you're sitting, you're not moving. So sitting requires less activation of muscle groups. So we talked about that in general, your core muscles don't work that much. If you are moving while your movers turn on, not your core. So there's different muscles being activated. But really, not moving results in loss of mobility and flexibility. The body really adapts to what we do. So if we're sitting at a desk all day, this is what our body gives us. But that means that we usually develop loss in trunk rotation, which is a really big problem that usually ends up causing neck, back, and sometimes lower level pain. Also the flexibility of, like, even with our neck being in this stuck posture, we get loss of motion through there. So one big thing about the forward head posture, and I'll turn through here, is that you can see with the forward head posture, the idea is that we're kind of stuck in this position. So I have some, if you slept in this position, kind of see how the shoulders run forward. Now when I look up, I'm really limited. There's not a lot of room for me to move, because in this slouch posture, I'm already partially extended. When I sit up tall, bring my chin back, now I can look up all the way. It really changes your ability to be able to move. That's one of the things I try to teach patients, especially the grad students that are always stuck like this. And when they finally get everything back, they're like, oh, I can move my neck. I'm like, yes, but you need to put yourself in that right posture and that alignment. So sitting isn't killing us. We need to do something more dynamic to kind of combat it. So that goes on to the idea of combating that chronic sitting, which is the concept of reverse posturing. Now, Mike Reinold, if you guys know, he used to be the PT for the Boston Red Sox, I believe. He's up in Massachusetts. He has a lot of information on this kind of stuff. But anyway, because he's famous, I always drop his name. What do you want? But the concept of reverse posturing is sitting isn't going to kill you. What the issue is not reversing that posture. So if we're stuck in this position all day, what is the reverse? And you can see the Brugers. I don't know who came up, you know, Bruger obviously came up with this name, but I keep thinking of bagels every time. But the idea is, what is the reverse of sitting in this posture? And so the opposite is if you stand up, feet shoulder width apart, chest up, head in neutral position, rotate the arms so it's up. So your palms are like this, not back here like we were at all day. You slightly tuck your chin, so it's not a tuck, but it's a slight tuck, a little bit. So instead of retraction, it's a tuck. One big thing therapists usually teach people that are new grads is keeping doing this. The more you do this, the more you're going to give yourself radiculopathy. You're going to get nerve pain. So instead, it's a slight motion like this. And that's a big yoga thing we'll go over in a minute. So this is the concept of Brugger's relief positioning. So the opposite of what you normally do sitting, you would open up and do standing, opening up the opposite muscle groups. And I'll go into that in a little bit in a moment. So let's go over some examples real quick. So this is a notice, be careful. All of us are at different fitness levels, different things going on with our body. At one point in my PT career, I was getting my master's degree, and both my parents had to go back for new careers. My mom had 3 compression fractures in her spine after transferring an amputee from the toilet to the wheelchair. So she went from being an occupational therapist to having a max lift potential of 10 pounds. So at this point, there's a lot of things she can't do, as you can imagine, with that kyphotic lordotic posture you guys saw on the one spine. Oh, that's my poor mom. Love her to death. She's kind of rigid at this point. So be careful with your body, because, you know, although I am a licensed practitioner, I'm not, you know, really knowing what's going on with your body and what I would recommend 100%. These are just generalizations. So we talked about the reverse posturing and the idea that what the components are. But besides reverse posturing, the next thing you can really do is work on end range end range motions. So things we don't normally do. Now, granted, as you can imagine, if you have sciatica, please don't do this one. But the idea is getting that max motion of your spine. So whether it be flexion, whether it be side bending, and then again, this is more of the thoracolumbar spine. Down here is more specifically the thoracic spine. Rotating, which is something we don't do a lot of unless you're doing, your neck can't move and you're driving and you're trying to rotate. And then the thoracic extension. So this one is actually one that I give almost all my patients with headaches, neck pain, mid back pain, low back pain, shoulder pain, tight shoulders. I mean, literally, this exercise does everything. So I want to show it to you briefly because the guy looks like he's crazy, right? So I'm going to bring my table down here. And can you see my table? Yep, okay. So I'm going to bring the chair down a little. There we go. Bring this up a smidge. Okay, so what you're doing is you're going to pretend this is your desk. So if you guys can try this, if you don't mind, you can turn off your Zoom videos. You're going to put your elbows as close as you can to each other. You're going to roll your chair back, dropping your chest and shoulders down, and you're going to bend your elbows. So in this position, you're stretching your triceps, you're stretching your lats, and then you're opening up the spaces in the spine between T1 through 3. So it's a way to actually fix so many things all at once. This one actually gave one of my frozen shoulders our mobility back. So you never know what could be really useful for you. But then the two ones that I find that are most easily adaptable to sitting in a desk or an office are working on the hip flexor stretching and the hip rotation stretch. Now this one's probably the easiest for you guys to do. So you can just, when you're sitting at your chair right now, cross one ankle over the opposite knee. If you already feel a stretch, that muscle particular is, it's your piriformis, so it gets a bad rap about a lot of things. Now this muscle tends to get tight, but really the most important thing is it tends to be spastic and spasm because it's trying to protect you. Muscles don't become tight or angry like here unless there's a reason. They're doing something. They're protecting you from something. So no matter how much your body is hurting, believe it or not, it's trying to protect you, I swear, just not doing a very good job. But anyway, so to stretch the piriformis, you literally just hold in your stomach muscle. So I call it a Kegel. So it's not a full Kegel. You just want to slightly lift your bladder so you can still breathe because of the diaphragm and the pelvic floor move together. But you slightly lift up your bladder and then you can partially lean forward. You're going to feel that more in those external rotators in your hip. It's a great way to stretch out if you've been stuck sitting for a long period of time, especially sitting in the car. That could be one thing that really inhibits these muscles. And by stretching them, you're stimulating them to activate them. These muscles, because we tend to sit with them, tend to get really deactivated because they're lengthened as opposed to being activated. Now, the most important one is the hip flexor stretch, and I want to show you why. So let me grab my spine. Okay, this poor dude's been with me since 21, guys, so be a little forgiving. Anyway, so the hip flexor, your main hip flexor, is your iliopsoas. So it comes off of your lumbar spine all the way up here. Goes in through the bony pelvis, comes out through here, and ends at the top right through here. So you can see how long and big this muscle is. But because it pulls on your spine, it actually moves your hip up. So when you're sitting, you can see how instead of this muscle being tight, it goes on slack. This is the main reason why we usually get a lot of pain in sitting. This is one of the main reasons why we get a lot of pain when going from sitting to standing, especially getting in and out of the car, is because this muscle ends up being tight. Now, the way we normally stretch hip flexors, or people think they do, is like, the quad stretch, where you grab your thigh or your heel and to stretch, or the idea of the lunge stretch. People really think they're getting this motion. You're not getting this motion unless you're tucking your tail. So I'll show it in standing, even though she's doing it in sitting. See if I can turn this down a little bit. There we go. Okay, so you're gonna put one leg back behind you like you're doing a calf stretch. Then in this position, all you do, you see how that curve in my back? You tuck your tail. It's just literally that tucking motion, that posterior pelvic tilt. And then you're gonna feel that muscle from the lumbar spine down through here. You're gonna feel it here. You might feel it a little deeper in the leg, but if you're just stretching here and feeling it in your quad, you're not getting the true deep hip flexor. That muscle is one of the most understretched muscles out there. Very few people, even coaches and things like in my high school students, track athletes, do they really get to this muscle. And it's probably one of the biggest causes of low back pain and hip pain and all these other kind of things in between. So that's why I want you guys to know this. Let's prevent your pain and help you do some of the reverse posturing. So what I recommend to tell my patients is in the half kneeling position when you're doing this, do an email this way. So I'll go down in my chair and I'll do one of my home exercise programs sitting in this position for about 30 seconds to a minute just to incorporate that into my daily life. If you're ever on a long airplane ride ever again, I have to do this for a minute every hour. Otherwise I hurt too much to get up. But in general, this is something that's really very practical and easy to implement, whether it be in half kneeling or whether it be in standing. But lastly, guys, this is my favorite thing is, we're talking about the Brugger again, but really the idea of true core activation. So no matter what posture we're in, if we're all kind of stuck in this forward posture, the biggest thing you can do is simply activate the right core muscles and everything else starts to fall into place. So I have mountain pose, is kind of what's sitting here. So if everyone can, I want you to stand up and let me move my table up. And when you're standing up, I want your feet to be about shoulder width apart. Okay. Now, the first thing you want to do is with your feet, you want to pretend that, with your hands how you cup water, you want to cup your feet into the ground. So this, I don't know what they call it in Sanskrit, but this is the way to stabilize your midfoot. This will stabilize your knees and it will stabilize part of your hips. The next part is you're going to Kegel. So you're going to partially lift up your bladder just a little bit. When you do that, you see how my ribs kind of come up a little bit? You want to tuck your ribs down towards your belly button. Even though it draws your head forward a little bit, that's where you want it to be. And then you're going to elongate your neck by slightly tucking your chin, relaxing your shoulders. This is real mountain pose. This is how you activate all the core muscles and stabilizers at once. So in yoga, they call it the Mudra Bandha, the Iliya Bandha, the Jala Bandha, right? But this is the way that you can reactivate all your core muscles and really get your body back on the right track no matter what kind of posture or pain that you're in. So I'm sorry I didn't get to show you more about the desk stuff. Big concept with the desk stuff is when you look at them, and I actually gave you a self-ergonomic assessment. So you can actually see exactly what your workstation should look like, where you should be reaching, the percentage of time you should be reaching it in, and why it's important, which is, I think, really helpful. But this way you have some ideas about how to engage the right muscles. If you guys want my references, I got a bunch of them, whatever. Okay, so let's stop screen share. There we go. But if you guys have any questions, I'm happy to answer them. This kind of stuff is really exciting because I want everyone to be pain-free. Big goal is honestly to not have you come to PT, be able to avoid it at all costs, in my opinion, but then at the same time, trying to set up your workstation in a way that will prevent further injury later on. So any questions?
I have a question.
Oh, go ahead.
Is that all right? I've been working at home and I obviously don't have a setup, and I broke my office chair yesterday. So I need to buy a new one. Is there